Welcome back. Gauteng is leading the third wave of infections and hospital admissions are steadily rising. The demand for intensive care unit beds is also increasing. Additional staff members and temporary support facilities for hospitals are just some of the measures that some of Gauteng's biggest hospitals have embarked on as admission numbers increase. So let's discuss this matter further with how Gauteng hospitals are actually coping with the increase in COVID-19 patients. Charl Van Loggerenberg from Life Care joins us now for this conversation. Charl, thank you so much for joining us this evening. Let's talk a little bit about how are Gauteng hospitals coping with the increase in COVID-19 patients.
Faith, thanks very much for the chance to chat. And I think you've summarised it perfectly in your intro. We certainly are seeing an increase in numbers. We are very definitely within the third wave. Across the Life Healthcare hospitals, we're north of 1,000 COVID-related admissions already, approximately 1,100. And more or less 700 of those are in Gauteng alone. So that corresponds, I think, with the national data. And the hospitals are certainly under some strain. As you correctly identify, resources are the key issue. And for many listeners or viewers, it might not be apparent what gives a hospital capacity. It's not simply the bed. It is also the skilled human resources, the doctors, the nurses in particular, that we require to staff the beds. So if anything, the pressure, as we saw in the first waves, is around nursing resources.
Yeah, and also, never mind nursing resources, are there even beds, enough beds, to take in some of these patients?
Yeah, it's bed capacity is a very fluid situation. You know, it remains in flux through the course of a day. As patients are admitted, they move through levels of care, they're potentially discharged. So bed capacity is one of those ever-changing situations within a hospital. There is capacity at the moment, so that's a yes to that answer, but that capacity is under strain. And what we're doing is sort of redeploying and moving nurses around to try and open up COVID-specific capacity within the hospitals that are under pressure.
Charl, won't you just share with us just some of the lessons learned from 2020 when we saw the harder lockdowns, when we saw the surge in the number of COVID-19 cases, as well as the subsequent impact that that's had on the healthcare system, versus what we're dealing with now in 2021. There certainly have been learnings throughout the course of the year. What have been some of those learnings for you guys?
Yeah, that's a great question. Within the hospitals, I think the learning has been, both clinical. The doctors and nurses have become significantly more expert at managing the condition and learning how best to treat patients, to optimize their care and facilitate getting them home safely and well as rapidly as possible, point one. Also around getting focused local responses. There's no point in a dictatorial or central approach. We find that working in an agile, flexible manner at a hospital level works best, with the doctor COVID committees, doctors taking ownership and charge of working with hospital management is a very effective partnership to get optimum bed capacity and optimum resources focused on looking after our patients.
Yeah, and if you remember, especially during the harder lockdowns, once again, it was the issue of keeping emergency rooms free, particularly during the weekend, where we see that a lot of the emergency rooms are full of people with either stab wounds or just needing immediate care. Will you be making a similar call as we're seeing this this increasing, spike now of COVID-19 infections, that guys keep the emergency room safe so that we can indeed take in more patients?
Yeah, I'm the emergency medicine guy, and for me it's about pleading to people to put me out of a job, right? I don't need to be busy with emergency medicine ever, although we're there and we recognise that emergencies will happen all the time. And, the safe message is emergency units certainly are open all the time, ready to receive emergencies 24/7. But the key emphasis really is on responsible social behaviour. Whether we're within a COVID pandemic or a COVID wave or not, responsible social behaviour is what drives adult emergencies. And I think for me that's just the sort of repetitive key message that we want to be putting out.
Yeah.
We shouldn't have to police people's behaviour, but we certainly would, I think, appreciate a focused approach from individuals and from communities, understanding that this pandemic hasn't gone away. This virus is very much still out there. It is spread within the community, and you as the individual have the power to reduce its transmission. As the vaccines become available to the different levels within our population, we're going to encourage vaccination, which will further add to an improvement improvement in the situation, but it really does focus heavily right now on responsible social behaviour in terms of staying home, staying safe, staying as isolated as possible, and freeing up that capacity within the healthcare system to manage your family and your loved ones that might end up being sick and needing our help.
And also, Charl, I mean, on the other side of it is also the issue of how, you know, we've got the patients that are not necessarily there for COVID-19, so non-COVID-19 related illnesses that still must be attended to. And what we also saw from the last two waves, so to say, is that a lot of the people that had some serious illnesses, whether it's treatment for HIV, whether it's treatment for diabetes and the like, pregnancy even, they were not going to the hospitals as often because many of them were choosing to isolate because of the fear of catching the pandemic or the virus within healthcare facilities. Have we now managed to facilitate effective communication strategy so that whilst we're in this third wave, people don't find themselves withdrawing and deciding to rather self-medicate as opposed to seeking medical care?
It's a great subject. I think, once again, you've actually summarised it beautifully. Have we effectively put the message out there? Probably not yet. It's an ongoing learning, I think. And it really just behoves people to appreciate that there will still be cancer, there is still hypertension, there's still diabetes, and all of those people, they're your family, they're our family, they need medical care for those specific conditions. And if we're saturating hospital capacity with COVID cases, then logic simply says that we're going to run out of capacity at some point. So it really does sort of strike a chord that says, people, you are in a position to help us retain enough capacity to manage non-COVID related medical problems if your behaviour allows us to just limit the spread of this particular virus.
Yeah, and very quickly, before we let you go, how much support do you guys need from government? Do you need it in the form of dissemination of information? What kind of support would you really require from government at this point, if any, in fact?
I think we're actually getting wonderful support. It's so difficult sometimes to hear a positive message, but we're working in fabulous partnership with the state healthcare facilities. Private and government facilities are communicating frequently. We've got committees and shared forums where we share information about beds and capacity. So I think it's really about keep doing what everyone's doing, allow the different facilities to operate at optimal capacity. Let's look at the trajectory of the vaccination centres at the same time to see if we can make our population safer. And let's support the socially responsible message.
Charl, we'll leave it there for this evening. Thank you so much for joining us. That is Charl Van Loggerenberg from Life Care.